Update on my wisdom tooth stuff while trying to keep it as fast as I possibly can, because the more that I talk, the more that my tooth scrapes against my cheek. On the last episode of Dr. Bird's Wisdom Tooth Woes, we saw me going to go to a dentist appointment for the first time since COVID started. Actually, let me just read you my formal complaint about a oral surgeon that I submit this morning to the Ohio State Dental Board. Dear Ohio State Dental Board, my name is Dr. Bernadette Bird Bowen. I'm contacting you today to submit a formal complaint about the mistreatment I experienced at the hands of Dr. blah blah blah. On the afternoon of June 10th, 2025, I sought out Dr. blah 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 for a wisdom tooth extraction because I am currently treating a wisdom tooth that is infected due to impaction and cutting into my cheek. As you can expect, this pesky little late-arriving tooth has caused swelling from the top of my mouth down to my jaw, inhibiting me from opening my mouth wider than about a finger and a half width. For context, I have not seen a dentist since 2019. Because I am a researcher who has kept up with the now going on 6 years of C19 research that shows it causes cumulative full body damage, and I am aware most medical professionals and otherwise have thrown caution to the wind, disregarding responsible preventative measures, so I ask medical professionals to wear masks if and when I feel comfortable doing so. Earlier that morning, I had seen a new different dentist who was excellent, Dr. blah blah blah, and they were made aware of the situation with my trismus when they could not fit the dental cavity x-ray device into my mouth to take x-rays. Instead of forcing my jaw open beyond its current limits, the dental hygienist and dentist decided to only take a full scan of my teeth another way that didn't require me to open my jaw, painfully disrespecting what my body feasibly allowed that morning. For further context regarding my jaw pain, on Sunday until I received antibiotics, I was barely able to open my jaw at all. The following day after 2 antibiotics, that space doubled, and the day I saw this dentist and Dr. blah 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 was only the day after that. Anyway, my new dental office gave me a referral to a different oral surgeon, Dr. blah 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 blah, for removal because it's clear that my tooth is impacted in a way that necessitates removal. Unfortunately, that office does not have availability until July 9th, and I'm trying to get this removed sooner, since it could likely become reinfected in the interim. I called around to a few oral surgeons' offices that I could find on the Signal Oral Surgeons referral list, and at the end of that, gave Dr. blah blah blah's office a call. They had an opening because someone canceled a consult that day at 3:40 p.m. Eastern Time, which I gratefully took. When I arrived, not only were all the staff not masked until I asked them to, despite running the establishment like a conveyor belt of constant patients, move from one area to another, significantly raising the likelihood of infection and disallowing for a full humanized experience with patients and caregivers, but beyond the mental irresponsibility of not masking, what happened next is what I am submitting a formal complaint to raise the Ohio State Dental Board's awareness. After taking my second full jaw x-ray of the day and waiting a very long time, Dr. blah 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 and an assistant entered my small consult room unmasked. There was no medical table, just a couple chairs in front of a desk and a side desk for the assistants to sit in and document. At first, we chatted a bit about how sophisticated the x-ray technology had become, and I was impressed as someone with a PhD in media communication who specializes in identities, relationships, technologies, and systems of power. Next, he shifted into how I'll need the tooth out because there wasn't enough space in my jaw and it's obviously cutting into my cheek, which I already knew and had been suffering the consequences of for days now, explaining to him the infection I am on amoxicillin to treat. Then he proceeded to pull out medical gloves from a desk drawer and said he was going to examine me. I asked if him and his assistant would put a mask on, and thankfully they obliged, even though by that time, if either of them were knowingly or unknowingly infected with C19, they had already filled the room with it. They both masked up. I begrudgingly took my N95 mask off, and he asked me to open my mouth, which I did to the best of my ability. Then he responded to my inability to open my jaw wider in a rather rude tone, might I add, something akin to, "Is that as wide as you can open it, or as wide as you're willing to?" And without asking or properly informing me of what he would do, he then proceeded to force my jaw open. Immediately, I winced in pain and reacted by raising my hand, desperately attempting to signal to him that he was causing me extreme pain. A nonverbal signal which he completely ignored and continued opening my jaw, increasing my pain and anguish. As stated, his assistant was in the room and saw him do this, but I do not know their name or have their contact information to be able to provide it below this testimony. At the time, him doing this not only hurt me immensely, but made me feel incredibly violated. However, as it happened, I did not have the space or words to properly process or articulate what he just did to me. As a lifelong sexual violence survivor turned researcher, I know that this experience in reaction to bodily violations is a normal one, and I also know the way the U.S. medicine often treats the human body like a machine for better and for worse, at the expense of our fully embodied humanity, pain, and feelings. as well as how it normalizes biases that are represented in the people who go on to practice medicine, again, for better and for worse. For example, in my search for oral surgeons, I found that only roughly 4 of 60 of them were not men, 2 of which only practiced on kids, and the other 2 of which were completely unavailable. Dr. Blah 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 then sat down and proceeded to explain to me that I am going to want to be asleep for this, meaning during the surgery, and I told him, I can't, it's only me, I need to drive myself home, to which he replied something like, we can try, but I know I can't numb, and he gestured down his jaw to the side of his mouth. All of this, which admittedly I was confused by because why would he need to numb that far to my mouth anyway? Any Novocaine I've ever received in the past, including surgery to remove my 2 bottom wisdom teeth in my mid-20s 10 years ago, did in fact numb that area sufficiently, so why would this be any different? I wasn't sure what he was getting at, and then he continued, and I'm going to need to separate your cheek from your tooth just to properly numb you. That was fair. I didn't know what that involves, but I do know that I would need to undergo whatever is necessary to remove this tooth growing into my cheek, so I thought, let's do it. The final straw on the camel's back for me was that he required an injectable lasting pain medicine that I'd never heard of before called Exparel. As someone who has a history of rapid heartbeat, heart palpitations, and severe allergies, currently seeking out an MCAS, mast cell activation syndrome diagnosis, this concerned me. The more research I did about the side effects of this 3-day lasting numbing medication, which as the pamphlet provided to me explained are nausea, fever, headache, vomiting, constipation, low blood pressure, low number of red blood cells, muscle twitching, blurred vision, itching, and rapid heartbeat. It also details that this medication affects the nervous system and the cardiovascular system, may cause an allergic reaction, may cause damage if injected into the joints, and can cause a rare blood disorder. After his violation of my jaw, I went out to the desk to schedule my appointment, still in shock and unable to properly process what he had just done to me. I spoke with the helpers there, and after providing me a pamphlet on this pain management option, I initially paid, scheduled, and signed on to the procedure for 3 reasons. 1, him and every other staff member talked Exparel up tremendously, almost as if they were a walking commercial for it, suspicious, despite its side effects and potential harms. 2, I need this tooth out as ASAP. And 3, I live paycheck to paycheck and did not think I could afford another oral surgeon consultation because they explained to me on the phone that I would likely be charged roughly $125 just for his consult that I'd already just taken part in and been painfully violated during in at least 2 ways. I would like to think that in the year 2025, oral surgery as a profession and oral surgeons are better than this, but I am sorely, literally and figuratively mistaken to find out that it's apparently not true in the case of Dr. Blah Blah Blah. Once I'd driven home, providing me more time to process his mistreatment, I cried in my car and then wrote a thread about what he did to me to better process the extent of harm his reckless disregard inflicted on me. I also then did more research about Exparel and decided to call his office and let him know I was not interested in Exparel being a part of my treatment plan after all. This morning, a member of his office staff left me a voicemail. I called them back, and that helper informed me that Dr. Blah 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 forces this medicine onto all of his patients despite its health risks. If this is the case, he should inform patients of that before he requires payment of a consultation, because otherwise he is entrapping patients into a pain medication that they may or may not consent or can safely be injecting with, considering the rate of heart and nervous system ailments are on the rise. Health, disability, and safety are not one size fits all, and his requirement of this medication disregards that fact. With little to no choice in the matter, I canceled my appointment that I scheduled to have him remove my wisdom tooth next Wednesday, 6/18/25, and before I hung up the phone, I informed the staff member who I spoke with about my complaint of his mistreatment and that I would be contacting proper authorities about how he violated my jaw, causing me undue pain and anguish. At the end of the day, this oral surgeon with 20 years experience should know better. He should be better trained in how to interact with patients at this point, but it's clear with how he mistreated me that he's not, and that he is also unwilling to read up-to-date COVID-19 research to protect us all by him and his staff wearing high-quality masks. Currently, I'm now seeking out a better arrangement to have my pesky wisdom tooth removed at an establishment that actually treats patients like human beings, not machines that they maneuver and adjust the jaws of painfully for profit. I look forward to hearing how this complaint can be sufficiently addressed and that Dr. Blah 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 can be appropriately held accountable and better trained to respect patients as a result of his mistreatment of me during my consultation. Thank you for your time, dedication, and expertise. Respectfully, Dr. Bernadette Bird Bowen.